Welcome to the Old Fashioned Health Network, where we always say good health inside and out. My name is Caleb Norman, physical therapist. Going to be kicking off the physical therapy segment today talking about total hip replacements. We call total hip replacements in the medical profession a total hip arthroplasty. Arthroplasty simply means a reconstruction. In this case, we're talking about a surgical reconstruction of the hip. So you might ask, what is the primary reason one might want to have or need a total hip replacement? Osteoarthritis is basically a degeneration of cartilage, which are the structures that surround the joint to give it its function, its properties. A degeneration of that will cause a lot of constant pain, chronic pain, instability in the joint, and just a lot of poor and challenged mobility throughout the day to complete your daily activities. So let's take a break. We'll come back and we'll talk about the physical therapy aspects and what you should expect and what I'm going to expect from you as a patient after having this type of procedure. All right, welcome back. Let's get into this total hip replacement. So the hip joint is a ball and socket joint, similar to the joint that you see in your shoulder. In the hip, you have the long bone of the femur here. It has a head we call the femoral head. This head here meets the socket, which is part of the pelvic bone that we call the acetabulum. This section, the acetabulum, the socket of the joint and the head of the femur is replaced by the surgeons to give its best functional properties and basically your new hip. So the hip is unique because you can actually flex forward, you can extend backwards, you can abduct outwards, and you can adduct inwards. You can internally rotate or you can externally rotate. All these things are unique and gives the hip joint a unique property and a functional, a lot of movement. Now, after having this type of procedure, let's talk about what you would expect as a patient, what I'm going to expect as a physical therapist. So, as a physical therapist, there are three things that I'm primarily concerned about following this type of procedure. One being safety, two being strengthening, three being function. So when I talk about safety, there's a few precautions and things that you should be aware of and avoid after having this type of procedure. These things simply just put a strain on the surgical area or the procedure that you just had done. So the first thing is excessive flexion of the knee, bringing your knee up. I want you to avoid to do that as much as possible. So that even means that comfortable couch or seat that you have in your house, that when you sit in, it sinks real low and it's hard to get up. Yes, that puts a strain on that hip. The next thing I want you to avoid is actually crossing your legs. That also puts a strain on that new hip. And the second thing is just excessive extension going backwards. Just as a general rule, it's just best to avoid those different movements to give yourself the best opportunity to heal as fast as possible. The next thing I want to move on to is strengthening. Of course, that comes with all the exercises and things that we will ask you to do as a physical therapist. I want you to strengthen all the muscles around the hip. The hip is a large muscle and has a lot of muscles that attach to it from the butt all the way to the side, and it just gives you all these properties and lets your hip move as many ways as possible and as strongly as possible. The next thing is function, which what we call, you might hear from the doctor or from another physical therapist as gait training. Simply is walking. We want to get you walking back as smooth as possible without any kind of deviations, limps, anything that does not look normal. So those are the three things that I'm concerned about as a physical therapist after you have this type of procedure. So we talked about total hip replacement and things that I expect as a physical therapist and things that you should expect as a patient following this type of procedure. Thank you for watching. This is the physical therapy segment on the Old Fashioned Health Network. We always say good health inside and out.